Hello. Rheumatoid arthritis is a condition that causes painful and swollen joints. Your body's defense system attacks your joints, causing them to swell. If left untreated, you may end up with joint damage. It's unknown why this happens to some people. However, we do know that if you have a close family member with rheumatoid arthritis, or if you're a smoker, you are at a higher risk of suffering from the condition. Symptoms are usually worse first thing in the morning or after a long period of rest. Common problems in rheumatoid arthritis include pain, swelling and stiffness of the small joints in the hands and feet. Sometimes the large joints are affected, such as the shoulders, hips or knees. If rheumatoid arthritis is not treated, you can develop deformities of your fingers and toes, which will make it hard to perform your normal daily activities, such as washing, dressing, writing and walking. A small number of people may find that other parts of their body are affected. This might include a skin rash, redness, pain in the eyes and damage to the lungs, causing coughing and shortness of breath. In some instances, there may be inflammation of the nerves. Although this is rare, it can lead to reduced sensation or weakness. Sometimes patients experience a sudden deterioration in their symptoms with worsening pain, swelling and stiffness. This is known as a flare. Sometimes flares settle by themselves, but if not, they may need treatment with a short course of steroids or an anti-inflammatory, such as ibuprofen. Nowadays, there are lots of treatments available. However, treatment must be started early to prevent long-term damage to your joints. When rheumatoid arthritis is first diagnosed, you'll be prescribed steroid medication, either as a tablet or an injection. Steroids reduce pain and swelling very quickly, but cannot be used for long periods of time. You would usually be prescribed a disease-modifying anti-rheumatic drug, or DMARD. DMARDs can be used for longer periods of time and help to reduce swelling and damage to the joints. Conventional DMARDs include methotrexate, sulfasalazine, hydroxychloroquine, and leflunomide. If your symptoms do not improve with conventional DMARDs, your doctor may discuss a new type of medication, known as BDMARDs. That's biologic, disease-modifying anti-rheumatic drugs. Most of these medications are given by injection. We will teach you or a family member how to do this at home. However, the medication must sometimes be given through an infusion or drip, which means you will need to come into hospital. DMARDs will only be started after careful consideration, as they can cause a number of side effects, including an increased risk of infection. Your doctor or practitioner will talk to you about the risks and benefits, and together will decide what treatment is best for you. Alongside medications, there are a number of things you can do to help manage your arthritis. Stay active. It's important to exercise and stay mobile. Stop smoking. If you need help to quit smoking, please ask your GP to refer you to a stop smoking service. And remember, always take your medication as prescribed and be sure to never miss a dose. If you want any further information about rheumatoid arthritis, please get in touch with a member of the rheumatology team or speak to your GP.